Ladies and gentlemen, thank you for joining the Royal Society for Asian Affairs second webinar in this coronavirus imposed regime. I hope that you can all hear me. I can see that that is true for some people already. Please just send a message if you're encountering problems and we will see if we can fix them. We are, I should tell you, recording this event today, and it will be made available more widely afterwards. And it is also being live streamed on YouTube for those who want to watch it without actually participating. I'd like to say a particular welcome to the large number of non-members of the Royal Society for Asian Affairs who are joining us online today. It's very welcome indeed to see such widespread interest in the subject. I think it makes sense. It's a highly topical subject. It's an important one. But we're very glad to have you here, and for the benefit of members of the audience, I'd say we have today well over 100 people online at the moment, and the numbers keep going up. And that audience is spread all the way from China right round the world through to the United States. To the best of my knowledge, we don't have anyone from Australia or Latin America, but otherwise we've got the world pretty well covered, and that is fantastic, and I'm very pleased indeed to see that. The way this works, for anyone who hasn't used Zoom before, you should have at the bottom of your screen, if you're using the Zoom app, a little symbol which enables you to raise your hand if you wish to speak. And I will see that you have done so and take an opportunity to give you the floor at some point. Apparently, no, we do have someone from Australia. Welcome, Marcus. That's really good to see. You can also send chat messages either to me, the speakers, or to other participants. Again, there's an icon at the bottom of your screen. And finally, if you wish to pose a question to the panelists, the Q&A button at the bottom of your screen is the way to do that. Without any more ado, can I hand over first to Kerry Brown, who will talk for about 20 minutes, I think, and then be followed by Ruby Wang, and we're very pleased to have them both. Thank you, Kerry.
Great, well, thank you very much. So I'll talk about the more political issues, because that's what I thought most about. I'm glad that Dr. Wang is able to talk about the more public health issues and complex and intricate issues about where did this problem originate from. I am not an expert on viruses, and therefore I am going to pass any difficult questions on that issue to her. But I think what I'm going to really talk about is, the origination of this issue, and then the narrative of what has been happening in the last 4 months of this still incomplete story. Hopefully, this issue is resolved quickly. The tragic outcomes have impacted on everyone, from China to the rest of the world. And I recognize that. I recognize, as I think everyone does, the seriousness of this problem. So I'm not going to really comment on this sort of issue in anything except just trying to stand apart from it and really look at what's happened so far and what that might mean. And the outcomes will probably be a long time with us. The initial handling of this problem in China was what most interested, of course, the outside world. And I think with the assumption, like SARS a couple of decades earlier, that this was going to be a regional issue and it was going to be an issue that impacted on China most. and that it wouldn't really come anywhere close to us in Europe or America. And of course, that's not the case now. It has definitely come to us, and it has made itself into a global issue. In January, when this issue first arose in China, a lot of commentary really was about how the Xi Jinping leadership was confronting its first significant crisis and how it was going to really manage that. The lockdown in Wuhan, the city in Hubei where this issue originally came to light, was something that was really striking. It seemed very draconian. There was kind of criticism really about how this would really be workable. Wouldn't people get terribly frustrated and irritated? And then there was a lot of criticism about whether the problem had been spotted early enough, had officials tried to cover it up, had doctors been giving alerts earlier on who were then silenced. So this really sort of played, I suppose, into a fairly well-established narrative, and one that's been growing stronger over the last few years, that the autocratic system in Xi Jinping's China is problematic, and that at some stage it will become problematic for itself. And that, in fact, because of the very likely powerful impact of this on economic growth, that therefore, this was going to at some point become not just a public health issue, but then a very, very serious economic and a political issue. In fact, we now see a few months later a sort of very transformed landscape in which the issues have become much broader and inevitably more complicated. The Xi Jinping leadership kind of, until now, seems to have dealt with the issue. There's been a few days in the last few weeks in which there have been no cases. Those cases, new infections that have arisen, have been from abroad. People coming back to China, lots of them Chinese returning students. And so you would say, in terms of implementing what were originally fairly harsh measures, well, it's achieved its goal. It seems to have contained the issue, and the fatalities in China have been less than, in fact, in places like America and Italy, and very tragically in the UK. And so if you were to sort of really look at this completely neutrally, you would kind of say, well, the Xi Jinping leadership dealt with the problem. So, okay, that seems to be something that we need to reflect on. But then, of course, there are the kind of issues that have arisen since then of, well, this kind of problem has now migrated to the outside world, and there needs to be some kind of accountability and inevitably blame. And that's, I suppose, where it's become a more kind of challenging geopolitical issue. With the nature of this problem was always likely to really, really be a huge challenge for whatever government was going to deal with it. I suppose the first step, I guess, we have to think about is whether the autocratic style of decision-making and management of the problem in China has, in fact, been more effective. Many would argue virulently against that, and maybe rightly so. The social and political context in which the implementation of policies happened in contemporary China, well, that's very different to Europe or America. And yet it seems that, these fairly draconian lockdowns, which we're experiencing where I am in the UK, and others are probably experiencing in their home territories, is a little bit similar in structure, if not in political content and context, to what happened in Wuhan, which was originally so vociferously criticized. So there is this sort of big question about, well, the systems, particularly the Chinese system, which was originally so powerfully criticized. In fact, it's not so easy to stand back and criticize the way it's managed this issue now just from today, because it seems to have managed the issue. And we are still in Europe and America trying to manage the issue. So how do we interpret that? And that's a question. I'm not making any judgment on that. That's just a question. The second, of course, is that in being knocked back by the impact of this huge issue, governments in Europe and America are, of course, keen to transfer blame from them to others. That's just politics. And I guess China stands as a fairly inevitable target. It is where it seems the problem arose. It is where there are kind of all sorts of discussions about whether the problem could have been alerted, the world could have been alerted earlier. And it seems to be happening, well, it is happening at a time in which China's role in the world is increasingly exposed and problematic. The size of its economy, the fact that it's in the middle of a deeply contentious period with the United States and others, the fact that its political model is so different to most others. This is, if you just stand back and describe this, this is a perfect scenario for the kind of pretty contentious, divisive sort of outcomes that we are now seeing. And so we are kind of in a common problem. We are, in a sort of sense, using common policies to try and deal with this. And yet we are definitely seeing things in a very, very different way. And the way we see that manifested, of course, is the attempt to really control this kind of narrative of culpability and accountability that we see now emerging. For certainly, politicians in America and Europe, there is, and commentators and people who are just sort of commentating from the public too, there is this strong desire to see everything that's happened in the last 2 or 3 months as vindication of the China threat becoming real. This is why China is a problem. It gives to issues like this. This is why we need to have these strong entrenched positions. For the Chinese government, of course, their effort is really to show that this is a common human issue. It could have arisen everywhere and anywhere. It's not about accountability and blame. It's about trying to deal with this issue. And, much kind of has been made of the sort of face mask diplomacy, the attempts to give aid, or in fact, the reality of giving aid to Italy and other places which have been badly impacted, and the way in which that messaging has worked quite effectively in China, but of course less effectively in the outside world, where many see it as propaganda rather than proper publicity. So this sort of struggle to control the narratives, which we are in the midst of, is parallel to the public health issues. It's parallel to, the kind of real issue of trying to deal with this highly infectious, problematic virus. But it's deeply intermixed and embedded with those issues. So really talking of where there'll be likely scenarios. So it seems to me that the COVID-19 issue has illuminated a couple of really important things. We were aware of them before, but I think it's really confirmed them. The first is the problematization of China's role in the world. This was always a problem. It's been a problem for decades, not just a few years. But now I think it's really, really come to a critical position. The proposition that China is a problem is now manifest in issues like the spread of this pandemic. And it is dependent upon the way in which this kind of problem unfolds. If the conclusion, the consensus in Europe and America particularly, is that this problem we have at the moment is specifically because of the political and governance structures in China, that had they not been the way they are, we would not now be dealing with these issues. We clearly have a big, big divide. This is going to be a kind of source of culpability, blame, resentment that is going to go deep into the future. And there's already been a lot of commentary by different think tanks and politicians. In the UK, for instance, Parliamentary Committee on Foreign Affairs has already been kind of speaking to this sense of, China needs to be held to account. And this is particularly focused at the fact that China is this kind of problem. It's been a problem we've known about, and now we have an event like this, which absolutely makes it unambiguous. So that will be something in which I'm sure political and diplomatic debate will focus on in the next few weeks and months. And the outcome, I'm not going to kind of be able to predict that, obviously, but the outcome's pretty important. Because if China is kind of framed as a problem which is sort of almost like an existential issue, the fact that China is the way it is means that, well, it's not just because China wants to be something for itself, but it's a problem for us too. It impacts on us. It really reaches into our well-being and lives. I mean, this is obviously a huge problem. The second issue, I suppose, is the deepening of boundaries which are already there. I mean, if China's problematization is as serious as it seems to be becoming. And if the diplomatic and political response from China is also unable to really kind of compete or win in this big kind of messaging and narrative and diplomatic fight, we seem to be moving into a world in which the boundaries between China and much of the outside world are going to be much, much deeper. They were already, because of the US-China trade war, deepening, but it seems that this has accelerated that far more quickly than others expected. That sort of deepening of boundaries is now actually visible in the fact that it is not possible very easily from Europe to go to China, nor is it very easy for Chinese to come out of China now to certain places like America. So there's a sort of imposition of control over people movement. But I think it's also a kind of psychological issue, the idea that this is a world which is divided, that there is, kind of us, and then there's China, and in China there's the idea that there's China and the world fighting against it. And you see this, in fact, in a lot of political and diplomatic language that's originated from China and in the US and in Europe, the idea that we are in different camps. So that implies a world which is not just sort of, not just sort of got boundaries, but is pretty polarized and divided, a very partisan world, and happening very, very quickly. This is not a world where we've had much time to build the sort of boundaries. They have just been almost kind of fallen upon our heads. The very, I suppose, final thing it's important to acknowledge is, despite all of that, it is pretty clear that the pandemic itself, which Dr. Wang will be talking about, well, that doesn't recognize boundaries, right? I mean, paradoxically, while we can kind of be erecting these geopolitical and other forms of boundaries, the one boundary that probably we would dearly love to erect is the one we can't, which is to stop this kind of kind of pandemic spreading. It's just not going to be cured that way. In all of this, I suppose the one thing that has been heartening is that academics in China and elsewhere have been working together quite significantly on trying to find a vaccine. And if that does happen, the symbolic importance of that will be huge, because it will show that there are certain issues that we can be incredibly wound up about, but they will not be solved when we're just sort of sitting on our own in our own little boxes. We're going to have to work together. So it seems to me that the kind of place we need to get through, if all of these boundaries get thrown up and they stay there for very long and in fact get deeper, is a place at least of pragmatic accommodation. We need to become much more pragmatic. There are a whole set of issues, of course, about the role of the World Health Organization, the issue around Taiwan that we could address. But I think I'll leave that kind of framework there, and then I'll pass to Dr. Wang, to talk about the actual practical issues of how this virus arose and how it's been dealt with, and public health issues around that. Thank you very much.
Thank you very much indeed, Kerry. Ruby.
Great, thank you so much, Kerry, for your insights. So here I will use my clinical background to talk more about how medicine and science have really intersected with politics in a unique way to kind of disperse into all levels of society across the world, into all nations through the COVID pandemic. And why has this virus spread around the world in a way that we've never really seen before, and taken us all to where we are today in a way that we haven't seen with SARS, with Ebola, with MERS, or any other previous epidemic, and how politics and society and the media have really sunk their teeth into this pandemic in a unique way too. Kerry mentioned the face mask diplomacy that China has spread out to the world. We've also seen leaders personally infected by the virus. You know, in the UK, we've had Prince Charles and Boris Johnson, the Prime Minister. And so even though this is not really a question of win or lose for any nation or success or failure, because any death is a death to be mourned, we've still seen numbers of deaths, numbers of infected cases being touted as, you know, how a nation has functioned and has strategized in terms of the coronavirus. So today I'd like to first talk about the virus itself, and the unique characteristics of the virus that have allowed it to spread around the world and form this pandemic, and then go on to talk a bit more about the health policy and management strategies of different nations, and then end with suggestions for action. So starting with the coronavirus itself, it's not actually a new virus. It's part of a large family, all called coronaviruses. The word corona from the crown-like protein structure on the shape of the outside of the virus. But COVID-19 is just a new mutation of this large family, which includes common cold viruses, includes SARS back in 2003, and MERS as well. And there's been a lot of debate, particularly in the past few weeks and days, about the origins of COVID-19. We saw previously that it was suggested the live animal markets, the wet markets in Wuhan was a potential origin of the outbreak. Previous days have seen debates about, you know, other potential origins, and here is where the medicine and the science has really strayed into political spheres. And so far we've seen, as of today, you know, over 2 million confirmed cases, over 127,000 deaths. And those cases that are non-tested are even higher. The 2 million is only those that have confirmed to be positive for the virus. So why is it that despite a relatively low death rate of 1 to 2% average around the world, how has coronavirus 19 spread across the world in a seemingly uncontrolled way to affect all of us on so many levels? And I would say that this is really due to the unique characteristics of the virus itself. First of all, it's very easy to be infected. So the virus is transmitted via an airborne route. And so you only really need to be coughed on or inhale an infected droplet from a cough or a sneeze from someone else within, you know, a 2 meter distance to be infected. An infected individual can also touch a surface, for example, a door handle or a tabletop, and that virus may survive on that surface by itself for any number of hours to days, depending on the environment. And the next person to touch that space can be infected if they touch it. The virus goes onto their hand, and then they touch their face or mouth, and that goes in via the oral route too. So this respiratory airborne transmission means that the virus is very infectious from an ease of transmission perspective. Secondly, the incubation period of the coronavirus is actually quite long compared to previous viruses we've seen in epidemics. We're still uncertain. There's been, you know, it's been suggested it can be 2 to 14 days from viral exposure to symptom onset, and there can be asymptomatic carriers perhaps. Scientists are still quite uncertain about that. And so virus-positive individuals are able to travel and infect potentially many, many others before appropriate measures are put in place by themselves or by the government. So, you know, infectious people can be traveling around, not appropriately socially distancing, not wearing a face mask, and therefore transmitting coronavirus to others. Third of all, the symptoms of coronavirus are mostly mild. Cough, shortness of breath, fever, and fatigue are the most common symptoms. And because this is not impacting the health of those individuals that are positive, this means they can still mobilize and transmit the virus. We've seen in Ebola previously, you know, there was a 70% fatality rate almost, very severe symptoms, and those that were struck down by Ebola were simply unable to move, simply unable to mobilize, and therefore the disease was, in a way, easier to control. However, in comparison, coronavirus, most people have relatively mild symptoms and therefore can travel around, and this means that distancing and lockdown measures are really, really key. And in China, we saw, you know, Kerry mentioned the draconian authoritarian measures where people were forced into quarantine, not allowed to go outside, were tested for temperature all of the time. And in comparison, in the West, we've seen a spectrum of strategies here, from hard to soft lockdown measures, different nations, different regions. Government has been quick or slow to implement lockdown measures, whereas whether people are allowed to go outside for a day, for an hour, shutting down schools, pubs, supermarkets, etc., or not. And also this is really dependent on the individual and whether they really comply with these government strategies as well. And then finally, the symptoms of the coronavirus itself are very non-specific, described to be flu-like symptoms, coughs, shortness of breath and fever. You can't tell whether you have coronavirus unless you're tested. There's no way to make sure simply through the types of symptoms you're having. And so testing is really, really key here. But testing itself depends on the capacity of that nation and also the choices that that nation is choosing to make. So we saw that South Korea has been testing a whole lot of the population. And once you've tested a lot of the population, you can see who is positive, and then you can hopefully effectively contact trace and reduce transmission. However, other countries, for example, the UK, have tested much less. And that's maybe, a balance between the choice, but also the capacity. We simply don't have the testing kits available to do so. And we're really trying to increase the numbers there. And then going on to the testing itself. So the testing I'm talking about here is antigen testing. You're testing to see whether the person is positively infected at that moment in time through the antigen, so particles of the virus, through throat or nose swab. And the testing itself is only 80% accurate, really. 20% of cases will have a false negative. You need a 48-hour window minimum to be able to get the results back. So 20% of people that have waited, more than 2 days to find out whether they're positive might not be, and they need to be retested and wait another 2 days or more. So this is a very inefficient and resource intensive way to find out the number of positive cases in the population. And therefore those nations with reduced capacity to do so have to reserve testing for those that are much more vulnerable or those that are displaying much more severe symptoms. And this means you're leaving a large number of people who are not tested or who might not be symptomatic but still are actually in reality positive. What we do with that proportion of the population? Well, we can only do things such as practice social distancing, practice hand washing measures, and so on. And we've seen, as I mentioned, different nations implement varying strict measures of those types of strategies. What has been most effective, however, if we look at these nations and we look at how case fatality ratio differs, I mentioned that global case fatality ratio, which is the number of deaths from the number of positive cases. That's really varied. So a global average is about 1.38% currently, and that's as high as 7% in Italy and as low as 1% in South Korea. And that really depends on the identification and the control, management and prevention of spread and of positive cases. So I believe that this really boils down to two main areas: social containment and the healthcare system itself. So first of all, in terms of social containment, I mentioned that government is really key here. So it depends on government to really implement a hard or a soft strategy in terms of social distancing, in terms of contact tracing, in terms of funneling resources into buying testing kits, and so on. And we've seen nations that have chosen to act much faster see lower numbers of positive cases and lower numbers of deaths. China, is included in that. They were very quick to clamp down in Wuhan and in Hubei province to implement a strict quarantine. We also saw countries such as New Zealand clamp down and implement a quarantine, even when they only had 6 positive cases. Taiwan similarly has been quick to do that, whereas other nations such as the UK, such as certain states in the US, have been much slower to do that. Have chosen not to, and have therefore seen, a comparatively higher number of cases compared to the population. Second of all, public response is key. regardless of what the government has chosen to do, it really depends on the individual and whether they're compliant to those measures. So, you know, we've seen media reports of people having parties, people gathering in large groups outside. So it really boils down to the individual and whether they're acting for the greater good or not. And that depends on the unique culture of that nation, really. And thirdly, you know, speaking more about the culture and the society of different nations. In Italy, such high case fatality ratios have been linked to the family structure. We have older generations living with much younger generations. We have an aging population. We have high numbers of smokers. All of those factors are really key in determining how dangerous and how much the virus has affected the population. And then secondly, going on to the healthcare system, treatment of coronavirus is really mostly supportive at the moment. So I mentioned mild symptoms like cough and breathing problems and fever. But in those severe cases where we see people passing away and going into intensive care in hospitals, they're dying because of organ failure. And the only way we can treat that is via supportive measures, making sure they have enough oxygen, making sure there's enough ventilators, and making sure there are enough hospital beds to manage those severe cases. And that itself is really down to capacity of the healthcare system. What types of resources are available, what types of funding there are for that nation to acquire more of those healthcare resources. And then secondly, the number and the expertise of the healthcare professionals. How many clinicians and nurses are there in that area to treat those patients? We've seen in the UK, you know, bringing back retired doctors, bringing back doctors who weren't currently working in the healthcare system before, recruiting medical students early to make sure that there's greater numbers of healthcare professionals to deal with the pandemic. And in China, we saw mass mobilization of clinicians, you know, more than 20,000 to the area of Hubei very quickly to make sure there was adequate staff capacity. And then finally, the responsiveness of those professionals is also dependent itself on the PPE, the protective healthcare equipment for those clinicians, whether they have, you know, hospital gowns, whether they have face masks, plastic face coverings, because if those clinicians are hit and infected and, you know, potentially pass away, we have less numbers on the front line to then tackle the next wave. So it's really a vicious cycle. And we really do have to rely on those supportive measures even now, because as Kerry said, we don't have a vaccine. And the vaccine, you know, people are jumping on that as if it's a miracle solution. Yes, it's potentially very, you know, it's potentially going to make a lot of a difference in the future, but making a vaccine takes a long time. It takes 6 to 12 months, multiple stages of mass stage trials over large populations with potential need for animal testing. That's simply not a measure that we can really think about today whilst we're racing against time. And the other thing we have to consider is medication. We've seen a lot in the media and in reports about potential medications we can use. You know, there's a lot of talk and hype about the anti-malarial chloroquine. We've seen Trump tweet about it. Other potential things like antiretroviral, HIV medications, even vitamin C was touted potentially. But when we're considering all of these things, we have to be very careful about the intersection between scientific research and politics and media, because science itself is based on repetition and based on efficacy and safety through evidence-based experimentation. We can't jump to a solution based on a single trial, on a single published study. But right now, that is what we're seeing. Intense public and media scrutiny, jumping on single case basis clinical trials to suggest that certain medications might be very effective, and the media picks that up, promotes it, and that leads to potentially dangerous consequences. In the case of chloroquine, we saw an American couple who consumed their fish tank cleaning product containing chloroquine because they heard that it might be effective, and the husband passed away and the wife went into intensive care. So when we're thinking about, you know, these very complex scientific and medical research, we have to be very, very careful about what's spread out into the public sphere. And we should really leave that research and that advancement to the experts and the professionals. And I think, you know, the media really has a role to play here in making sure that they keep people safe by not promoting the wrong information. And overall, I think that, you know, as Kerry mentioned, there is a lot of intellectual collaboration taking place around the world, which is very, very promising. China has been much faster to act in the case of the coronavirus compared to SARS previously in 2003. It's still been criticized, you know, in the speed to action, but 5 days after they did decide to announce coronavirus officially, they shared the genetics of the virus with the world in order to promote vaccine development, testing kit development for other nations. We've seen rapid publishing of scientific research, clinical trials taking place in China and around the world through multiple international journals. And this type of collaboration across the scientific community globally, added with, you know, funding and support from private and public sectors, from government, from pharma, from tech companies, is very promising and very exciting. But I think, you know, one of the things I want to end with is, in terms of medication, we do have to be quite careful. Even if we find, hypothetically, an effective drug, a miracle drug that works well, that we have to go back to this classical dilemma in terms of medicine and in terms of big pharma. There's cost versus effect. If you find a drug that is effective, but it's priced highly, versus a drug that is, you know, brings maybe, you know, a 10 to 20% margin on benefit for patients, but is priced lower, which would you choose, and which would this government or this nation choose to use on its patients? That's, you know, an ethical and a moral dilemma that's very, very difficult to answer. And overall, you know, if a drug is effective, who is able to access that? Is that privately or is that publicly? Is the individual going to pay or is the government going to pay? We've already seen this in terms of coronavirus testing. We've seen heads of state, celebrities, those that, you know, are more able to access these tools, being able to access them, whereas, you know, members of the public might not be able to and have indeed pushed back. And so overall, I would say, you know, there's been lots of criticism and praise from the East to the West and back. Who has been successful, who has not, who has given an effective strategy to manage coronavirus? I think it's still too early to say. We're still in the middle of it. And, you know, indeed, each nation has chosen to implement different types of strategies. But overall, it really comes down to a blend of fast action, innovation in terms of policy making, which is coordinated by the government and then implemented by the people. And each actor in this equation is really as essential as the other. So overall, even though coronavirus have really, you know, fragmented the structures of our healthcare systems and society, I really do hope that when we finally come out on the other side, as long as that may take, we can use this opportunity to really transform healthcare systems as a whole, not only for the UK, for the US, but for China and all nations, to make sure that healthcare is not only prioritized when it affects all of us, but also pushed to the forefront always, and not only when it affects the old and the weak and the sick. And that we can hopefully put greater focus and greater resources and support into healthcare to prevent situations such as this from happening in the future.
Ruby, thank you very much indeed. Huge amount there for us to think about, and a lot of questions have been posted. I'm going to try and separate them into categories as far as I can, and there's a broad division between questions that are asking about the coronavirus outbreak itself, evidence, and the sort of issues around vaccines and so on. And there's a separate set of questions that focus on the international relations implications. And I'll just start, if I may, with one of the latter. Lawrence Goodchild, who, for the benefit of the audience, is where the RSAA is fortunate enough to have as our contact in our publishers at Taylor and Francis, has asked the following question: does the narrative of China as a problem due to COVID-19 or more broadly have traction outside Europe and the USA? How is this issue being perceived by those elsewhere, particularly in the global south? And if I could just link to that a much more narrowly focused question, but one I think that is related, from Dan Huntington: are China's figures on C-19 deaths, infections, etc., to be trusted? Kerry, could I ask you to?
Yeah. So the kind of problem of China is different in different places. And it's interesting to sort of think what it means to say that China is a problem. So I think in the United States, China is a problem because with its political model, it is still very likely to be the world's biggest economy sometime in the next decade. So that's despite the pretty disastrous impact of COVID-19 on economics. And I didn't say much about that, but of course, there too, we are all in the same basket. China's first quarter growth is likely to be terrible, or to be non-existent. And I think in China, it hasn't really had negative growth for 40 years. So we are now going to see a China which may have negative growth. And of course, in the rest of the world, it's going to be pretty catastrophic too. So, you know, kind of this issue of China being number one, at least in one respect, for America is psychologically very, very problematic. For Europe, of course, it's a strategic dilemma because, like in the UK, but also elsewhere in Europe, our principal security partner is the United States, and yet we still want to get certain things from China economically. And of course, that strategic issue isn't going to go away with what's just happening now. It may even kind of become worse because maybe our economic engagement with China will become even more urgent and necessary. But it's certainly true in the region. The closer you get to China, the more specific the problem of China becomes. If you're one of the contesting parties to the South and East China Sea, for instance, that dispute, then it's going to be an issue. But also if you're in Australia, the public debate there at the moment, of course, is pretty divided, even worse, I think, than in the UK, maybe comparable to in America, because of the extraordinarily high importance of Chinese investment and Chinese trade and Chinese students, universities in Australia in the last decade, but the fact that there are significant political differences. So across all of those different geographies, what is the common thing? I suppose the common thing is that China's political model is something that makes it very different to anyone else. There's only 5 countries with a Communist Party with a monopoly on power, and most of those are pretty small. China is the great exception. But there's also the fact that the way in which China has risen to this position has been fast, and no one's been quite prepared. So if there's one thing that has been distinctive about the last 20 years, at least, it is that things have happened way more quickly than anyone expected. And this COVID-19 issue is symptomatic of that. I mean, it's happened so quickly. We don't know where on earth we are because things are happening at such a speed that, you know, we're kind of still wrestling with the issues of yesterday, and we've got a whole bunch of new issues suddenly coming to hit us. So it's kind of symptomatic, I suppose, of the speed at which China kind of creates these sort of challenges. I suppose the final thing I'd say about this is about this sort of rather grubby issue of pragmatism. I mean, there has to be a recognition of certain facts rather than the sort of tendency to kind of get idealistic and just hope that the world will magically turn out to be the way that we want rather than the way it is. And I think that's really true about China. We have since 1978, when reform and opening up started in China. Really, I guess, as Europeans and Americans hoped sincerely that through economic engagement, things would happen politically that made China more similar to us politically. And that, as of today, hasn't happened. In fact, it seems less likely to happen today than it did even 5 or 10 years ago. And I suppose at some point we just have to accept that a fifth of humanity is under a system that is problematic, but it's going to stay that way. And this sort of COVID-19 issue is, I suppose, a great moment to sort of accept the things that Dr. Wang was talking about, of cooperation, common kind of public health and other issues, learning from each other, to accept that stuff, but also to recognize that we have big differences, and we're just going to have to get, a knowledge level and a language level and a level of discourse where we can manage that. Because the fact of China being the way it is, the very likely fact that it's staying that way for the foreseeable future, the pretty high likelihood that even if it were to change, it would change into something not at all the way that we ever expected, because nothing else in the last 40 years that was expected about China ever went right. So going from the past precedents, we don't have a great deal of confidence that we're going to be right about what happens in the future. So I suppose we just have to pragmatically accept these things. And I guess this is the moment when we can kind of do that, because it's in our interest to. Whether we will or not, well, that's what we're seeing wrestled over at the moment. On the vaccines, I'll leave that to Ruby. Thanks.
Ruby, can I? Thank you very much, Kerry. There's a question here that is essentially about the data in China, but goes very much also to the sort of broader issues that Kerry was just talking about. It reads as follows: Dr. Wang, how can you explain absence or difficulty of access to the number of tests conducted by China? Major websites which cover progress of COVID, like Worldometer, Our World in Data and Wikipedia, have information on numbers of tests of individual countries except China. How should we read this?
Yeah, thank you, Michael. I mean, this is a difficult question. I'm definitely not the expert here to answer that question. In terms of the number of tests, I can only say from the medical perspective, two things. First of all, number of tests and number of cases. It's difficult to count this accurately in any country, and it's a question of whether we're looking at this from a healthcare perspective or really from a political perspective. If we're really thinking about number of cases and number of tests on the individual level, those that are asymptomatic but test positive, should they have been tested in the first instance? Did they need to be? Those recovered may still test positive. We're really unsure about that from a scientific perspective. Does that and should that be counted in those numbers? For example, China did not, first of all, count asymptomatic cases in its numbers reported, whereas other nations chose to do so. Is there a right or wrong there? If people have passed away already, they wouldn't be tested anyway, so that would, make the number of cases inaccurate in terms of report versus reality. And whilst keeping track of numbers of cases, numbers of tests and numbers of deaths is hugely important in terms of following the spread of coronavirus across nations around the world, it's really an impossible task that each country is trying to keep up with. And I do think, from a clinical perspective, which is of course where I'm coming from, it's not so much the numbers of cases, but how we're actually managing that on the front line in terms of the healthcare professionals and what they're doing, rather than, numbers of cases, numbers of tests, which I don't honestly have a true answer to. Yeah.
Could I, thank you very much, Ruby. Could I just bring in here part of another question, one participant has commented on what he describes as delayed and inaccurate reporting of medical data to the World Health Organization by China in the early days of COVID-19. I guess one could debate that, but the key question he asked, I think, is how can multilateral organizations learn to better work with China to avoid similar problems in the future? And the WHO, of course, is under fire itself from another direction at the moment, justifiably or not. Could either of you comment on that question?
Well, the World Health Organization is not having a good time, right? I think their senior officials, I don't think that they're going to think of this period as a happy one in their careers. I mean, I guess the issue really is that this sort of pandemic, of course, has not happened in modern times, and so it's challenging. And in this particular area, where the kind of public interest is that everyone is somehow involved in the WHO, the fact that Taiwan isn't a member and yet has done very well at dealing with this issue. I mean, Taiwan's, I think, fatalities have been 5, something very, very low. It's really, and without draconian lockdowns, as far as I understand, it hasn't, implemented anything like the kind of measures that have been necessary in Europe. It's pretty successful. So this is somewhat embarrassing, that the only significant non-member of the WHO has been fairly successful. So I think that will be one of the kind of issues in the future. The fact that Trump has not, said that the membership of the WHO is going to be, or the payment to WHO is going to be reviewed by America, shows that this organization is going to be profoundly politicized and has been politicized. But I think it's hard to kind of extrapolate from that to other kinds of multilateral organizations. The WHO is a very specific case, and this is a very specific issue. And will this somehow impact on China and the world's engagement in other multilateral entities like the UN or the IMF? Well, I think they were already fairly sort of problematic anyway, but not in the way that this is. Everywhere, public health is a massive political issue. In China, it is, along with food security, I think, and food safety, the most sensitive issue. It is one where leaders who make mistakes pay huge consequences. It is not surprising in that context that the stakes are so high. Trump has an election to look forward to. Our own Prime Minister in Britain has obviously personally suffered massively during this issue. So it is not surprising that everyone is looking for someone else to point the finger at. I suppose for China, it has just got to do everything it can to avoid that finger being pointed too resiliently at it. At the moment, I have to say it's not doing a super great job, but that's what it's got to do. Because it isn't all about someone taking the blame for this. It is about everyone trying to work out how it happened, why it happened, and what we can do to avoid this ever happening again. But that's not going to be about pinning the blame on one particular person in an unfair and disproportionate way.
Perhaps just sort of taking that in the sort of more clinical direction for a moment, a number of participants have asked about the origins of COVID-19. I mean, this is, I guess, not about pinning the blame on an individual, though possibly pinning the blame on a species of some kind. The question is, could you both speak more to the debate on origins, wet markets versus labs in Wuhan?
Dr. Wang will be able to talk about that.
Yeah, it's an interesting question, and it's been under scrutiny, particularly in the past few days. We've seen some reports suggesting that it wasn't the wet market, but actually a research lab near Wuhan as a potential, other origin. I would have to say this is a case again where science versus the media. So once, a rumor goes into the mill, it undergoes mutation, it spreads like wildfire and people latch onto it. But if you go back to the beginning and you look at the science, you know, there is no way that we can really confirm the origin of the virus. This would take, you know, a long time, maybe years, and I don't know whether we would actually ever be able to come to a true conclusion, whether it was the wet market, whether it was the lab, whether it was anywhere else. Such investigations require extensive forensic tests of samples, of those labs, of those markets in questions, going back to look at the genetic sequencing, which is near impossible because now that the virus is spread around the world, we have multiple strains, A, B, and C. We have different strains in Europe compared to in East Asia, compared to within China mainland. So is it really possible to find the true origin? No, not really. We only have these theories, these opinions, various, you know, studies, reports, articles that have been published and really pounced on by different members of the media of different nations to their own political benefit or otherwise. And I would say for the moment being, it's quite dangerous to connect the politics with the science because we have no way of finding out what is the blur between fact and possible fiction. And really we should be focusing on our energies on how to mitigate the spread rather than looking backwards to see where the source was. That's not really key right now. That will not help us prevent further deaths. So it's a question that really can't be answered, and you know, we shouldn't really be focusing the time on, in my opinion, and we should be working together to make sure there's, as Kerry said, global collaboration to mitigate the spread.
Thank you very much. I mean, there's plenty of scope for ongoing debate on that. It's worth perhaps remembering that there is still some dispute about what exactly the disease was that is known as the Black Death in Europe. We've been wondering about that for the better part of 700 years. Could I just turn to trade issues for a moment or two, because we've had a number of questions here. Questions about what impact this crisis will have on the Belton Road initiative, both from the perspective of China and from the perspective of countries on the, if I can put it like that, the receiving end of the Belton Road, but also China's relationship with Africa. Is there a read across there?
Yeah. Okay. So on the Belton Road, I mean, Xi Jinping, I think a month ago, talked about a health Belton Road, and that sort of was at least an attempt, I suppose, to spin a kind of positive out of what's happened. The Belton Road, though, is such a sort of grand and somewhat nebulous idea that I think it's hard to sort of extract something very, very definite from this. And of course, it has been eclipsed by the fact that a large number of members of the Belton Road, this informal area, are not going to be very open to China just because of the restrictions on people movement at the moment. And when all of this issue hopefully clears up, then the Belton Road will have to have a restart. At the moment, though, I think the economic issue, I guess, for China is that it is integrated into the global economy very deeply, and a lot of its supply chains, a lot of its finance and capital flows have been hit by this issue. It will probably want to, as Li Keqiang, the premier, said a few years ago, focus on domestic sources of growth. But I mean, it's not going to be able to do that as quickly as it needs when some of its most important markets and partners are going to either be suffering economic problems or be wanting to not deal with it. So I think we're in for an economic kind of, a tough time. And Africa, so the reports, of course, particularly, I think in Guangdong province, but elsewhere in China, of behavior by Chinese officials or by Chinese, some individuals towards Africans has been pretty distressing. The African Union, I think the ambassadors in Beijing sent a letter to the Ministry of Foreign Affairs. I believe it was also published, really protesting about how Africans had been not allowed, despite long residence in China, to use facilities that others were allowed to use despite observing all the rules. The issue, I guess, here, I mean, it's been a long-term problem that China has invested enormous diplomatic capital in Africa, and this kind of thing can undo that really, really quickly. Now, whether it has really undone it, I don't know. But I mean, it sounds at the moment like things are really deteriorating. And China has been hugely active in Africa, many kind of interests there. And I think this will have an impact. I hope it won't be a deep and long-term impact, but that's going to mean a lot of remedial attention by Chinese leaders and officials to the way that a lot of people have been dealt with in China recently.
Thank you very much. There's a sort of reciprocal aspect to this, Kerry. You picked up there on the way some Africans in China have been received recently. From Australia, I have the following question relating to the Chinese diaspora there. The questioner notes that political leaders are sending out a constant message that China is to blame. Is there more that China can do in its public response to the pandemic that will help Chinese diaspora nationals in Australia and elsewhere be safer from retribution from those who think they are in some way or other to blame?
In practical terms, I guess I'll leave Ruby to say something about what the Chinese government do in terms of, sort of helping other health systems and other communities abroad, practically. Politically, it's very problematic because in Australia, it's not a recent thing, but the worries about, kind of the Chinese influence there politically and otherwise. I mean, this has been something that's grown up in the last few years, but it was already well established with, the kind of worries about being under the influence of, kind of other parts of Asia. I mean, Australia has always had a sort of vulnerability in many ways as being a sort of European nation in the middle of the geography where it was quite isolated. The issue, I suppose, of how the blaming of China in particular places leads to racism and gives license to people, therefore, to blame particular groups. This is really serious. And it is really important for political figures to particularly think about the implications of what they say beyond just, kind of talking about the political blames and all the rest of it. The fact that there's been language that has been so strongly opposed to China, because of political issues, that can be used often by others with very unpleasant motives to then kind of give them license to do things, to sort of blame people in communities. Trump's language about the China virus, therefore, was symptomatic of that. I'm sure he meant it politically. I'm sure his attitude was, we're not going to take the blame for this issue. But of course, it migrated or it made itself into other areas of discourse in which it was used to give license to sort of really appalling attacks on people of Asian ethnicity, some of them from Taiwan, who are meant to be allies in all of this for America. So I think, this is really a serious issue and it needs leadership. To his credit, I think Boris Johnson has, when he was still well, kind of avoided, really made sure that he avoided all of this talk. I mean, kind of he was having phone calls with Xi Jinping and, kind of just talking about the practical response. But I think that there needs to be more of that. There needs to be real leadership about that. It is fine to get sort of annoyed about political issues, but I mean, it's gone way beyond that, and people have suffered consequences because of that. But maybe, you know, Ruby wants to say something about the practical issues and how that might work. Yeah.
Yeah, I don't have much to add. I absolutely agree with everything Kerry has said. Just to, you know, echo the fact that it is a true shame that, you know, in such a pandemic where, you know, lives are being lost, people are suffering, are sick, are dying, that certain focus has been placed on blame instead of working together, and blame on innocent people of, you know, Chinese diaspora around the world, whether that's Australia or the US or the UK, and just to hope that, you know, as people become more aware and as leaders, you know, strive to reduce that kind of prejudice, that we're going to see less of that in the future.
Thank you. Could I lob in here two other questions that are closely related? The question that has been raised by many people, particularly in the US, about the extent to which China has underreported COVID-19 cases, does seem to be echoed by some Chinese social media comments. And the questioner asks, does the panel have a view on the credibility of the allegations that the numbers are being underreported? We've commented a little bit on that already. And the second part of the question, what do the panelists think is the likely long-term implication within China? And another questioner puts that even more forthrightly, what impact will the health crisis have on Chinese people's opinion towards their own government, and therefore on the PCC's legitimacy at the domestic level?
Okay, well, so on behalf of 1.4 billion people, I will say how much we love our government and how, I mean, so there's been obviously criticisms and, you know, very unsurprisingly, you know, kind of all sorts of voices in China that are not super happy with what has been happening lately. You know, public health is an issue that kicks people off everywhere, rightly so. It is incredibly important, and the idea that, you know, all Chinese people have one opinion about this is obviously not true. However, ironically, I guess if you were to sit, I mean, I'm just sort of speculating now, if I was being sort of sitting in, you know, kind of Beijing or Wuhan, and looking at what has happened in the world around, I'd sort of be a bit more ambiguous about, you know, kind of exactly who to blame and what, you know, what the situation is. Because firstly, no one has really done a great job at dealing with this issue, as we said right at the beginning. And secondly, as a Chinese looking at some of the language that has emanated from figures abroad, you would think, wow, well, you know, we may not be living in paradise, but my God, we don't want to go out there too much because it's kind of terribly hostile. So I think it's made things pretty complicated. I think it seems that most Chinese people that I've sort of interacted with know there are legitimate criticisms, but they're also extremely wary of being sort of dragged into these kind of, you know, kind of big arguments abroad about how China existentially is the cause of all of this, because I don't think they think that either. So, I mean, it's not going to be easy to really plot the long-term impact of this. Is this going to be fundamentally undermining of the Xi Jinping regime? I don't think so, because that is incredibly entrenched, and, you know, it's sort of dealt with the initial issue. Where the battleground will be, and it will be the same for the rest of the world as it is for China from now on, is the economy. So once this virus issue is over, and the sooner the better, the battleground shifts to the economy. And that's where we will see the long-term impact of this, because if China can't come up with, if the Chinese government can't come up with answers there, then there's going to be a significant problem, as there is for any other government. So ironically, we all end up in the same kind of space.
Ruby, do you want to add anything to that?
Yeah, again, not much to add. Thank you, Kerry. But in terms of credibility of these allegations, again, is this political credibility or is this, health statistics credibility? Because I really do feel like those are two separate things. Political credibility, that goes along the same wavelength of, does the West trust China in terms of its GDP reporting, all of that. That's a whole other stream compared to, is this credible from a health statistics point of view so that we can all work together to reduce the spread? So I do think that those are two very separate questions, but the root of it is whether China has underreported or not. From a statistical perspective, no country is able to accurately report to the number ever, as I mentioned, asymptomatic or symptomatic deaths or tested. It's just a question of what proportion of real numbers versus potential numbers is being reported, and that's a really, really difficult question to answer, and one that we may have to wait until a certain amount of time before we can truly look back and see, or maybe it will be even harder to say even in the future. It's difficult to know.
Thank you very much, Ruby. We're getting near to the end of our time, but before we finish, I will in a moment give the microphone to Dr. William Payton, who was the director of the United Nations Pandemic Influenza Contingency Unit set up to address the bird flu pandemic in 2006 to 9, and who has for some time now been a resident of China. Bill, you have the microphone, Bill.
I think he's still muted. It sounds like
Yes,
he's still...
yeah. I am having difficulty. There we go.
I got it. Sorry. Yes, am I on now?
Yes, you are.
Yeah, yeah.
Yes, apologies. That was my first time with this software. Yeah, hi. This is great. A couple of things. Dr. Wang, I totally agree with you that it may be years or even centuries, Professor Ryder, before we figure it out. One little refinement, though, we do know that it didn't start in the market. So, the first 20 or so people who were infected had not been to the market. So we know somebody carried it into the market and then it spread from there. But the rest of what you said is absolutely accurate, and the gist of what you were trying to say was spot on. And then I think also staying away from the blame game. To come to the numbers question, which unfortunately has become central, the dynamic here has been really very interesting. First of all, we had a mass suspicion of a cover-up, which provoked a kind of social media rebellion and outrage. The government very quickly corrected course, sent someone down from Beijing, and took the other tack. And within about 10 days of that, I received a piece of software to download on my telephone here, which began to inform me every morning of the exact number of diagnosed and died. Now, I'm in a small community, and I know the head of the unit who was in charge. And a friend was sick at the hospital, so I also had to visit the hospital. So I'm in a unique position to judge. And the numbers were absolutely accurate. If someone had died and their death had not been reported, it would have spread within hours. If someone had even just gone down and been diagnosed and the numbers had not risen the next day by 1, it would have spread within hours. And the numbers we're talking about were only 15 diagnosed and 1 dead. So, everybody was wired into it. The city is less than 1 million people. So I feel like it was a kind of a blockchain. And from a, put politics aside, from a scientific perspective, these numbers are provable. So I feel that the accusations against China are completely unfounded, except for perhaps the behavior of provincial level officials at the beginning, at the very beginning, which is, you know, not a new story anywhere in the world. And that they are basically political in origin and in intent. And that the numbers here continue to be verifiable in this way. If they run on the national news that today, or rather yesterday, no one died, and your grandma died, do you think this country wouldn't notice that? So I'll end there.
Oh, you're on mute.
Thank you very much indeed, Bill. That was fascinating. Kerry and Ruby, I don't know if you have any sort of final comments you want to make. I am going to have to wind it up now, I'm afraid, because we are out of time, and I'm conscious that there are a lot of questions that I have here that we haven't been able to address, but I hope that we've managed to cover at least some aspects of most of them. Any final thoughts?
Just one thing. So just one thing. Dr. Wang and I have an article in Asian Affairs, which I think will be online quite soon, which will go into this in more detail. So that, I mean, for anyone who wants sort of background and kind of more sort of detailed argument, that will be, I think, out in the next couple of weeks, I believe, quite soon.
Yeah. Thank you indeed to UK for advertising that, and to both of you for having written it. We're always glad to be able to publish good material. For those of you who are joining online, if you're not members of the Royal Society for Asian Affairs, you are still welcome to join in future events of this kind. Next week, we will have a webinar devoted to the various responses of the different Central Asian governments to the COVID-19 outbreak. And that will also be on Wednesday, at a slightly different time. We will be putting the advertisement out for that within the next couple of days. But thank you to everybody for participating. It's been a very interesting discussion, some fantastic questions, and thank you particularly to Bill Payton for his exposition from China. Thank you very much indeed.
Thank you very much. Goodbye.
Thank you.
Bye.
Bye-bye.